Well, good afternoon, everybody. Welcome to this community forum on health and human rights. We're delighted that you could join us here on the unceded lands of the Kulin Nations. My name is Jonathan Abrahams. I am the director of the Monash University Disaster Resilience Initiative, and we are very much building collaborative partnerships at this convergence of the three global challenges that Monash has in terms of climate change, in terms of global security, geopolitical security, and thriving communities. And central to all that we're doing is addressing equity, human rights, really building partnerships and strengthening relationships, because teamwork is essential to everything that we are doing in community resilience and disaster risk management. Just give you a sense of what we're going to do today. We have 50 minutes, and after this session we encourage you to join the plenary session. It's the big issues session in plenary, which is also looking at health and human rights, focusing on action in 2024. So after this, please go ahead to that particular session. So I will introduce our speakers, and then after that we will come to you to give you the opportunity to share your experience, your perspectives, your lived experience of working with communities in relation to health and human rights. Now, the first thing I would like to do is I have the pleasure to introduce Olivia Bonanno, who has played a key role in the organisation of this summit. Maybe many of you have received a message from Olivia. She probably knows more about you than you know about her, but we will hear a little bit from Olivia now. So Olivia is a proud Wagaya and Wemba woman. She's a graduate of Deakin University in Health Sciences and has been recognised for her outstanding leadership through her involvement in Korangamaji Institute programs. As an ambassador, Olivia was empowered to embrace her culture in the context of leadership and develop the strength and skills to advocate for Aboriginal and Torres Strait Islander people now and in the future. We're honoured to have you with us here today. We know that this was one of the sessions that you earmarked, so it's great that you could join us. I'd like to invite you to share an acknowledgement of country and to share anything you would like about the forum and the program that we have here. Over to you.
Thank you, Jonathan. Dalk, everyone, which means hello in Wagaya language. My name is Olivia Bonanno, and I'm a proud Wagaya and Wemba woman and an executive member of the organising committee for the 2024 World Health Summit Regional Meeting. I have connections to the land in what we now know as Northwest Victoria, where you will find the Wimmera River and Swan Hill. I'd like to begin this session by acknowledging the beautiful country that we are on here today in Naarm. I pay my respects to the traditional caretakers of this land and the water on which we meet, the Wurundjeri people of the Kulin Nations. We are here together beside the Birrarung Ma, now known as the Yarra River, on Wurundjeri country, which has been cared for by the Wurundjeri people for thousands of years, long before the land was invaded and decimated. Sovereignty was never ceded, and this always was, has been, and will be Aboriginal land. I extend this respect to my Aboriginal and Torres Strait Islander elders, past and present, and all Indigenous people who join me in here today. I'd like to take a moment to pause and acknowledge the strong Aboriginal women who have come before me and my family, my mother and my late grandmother, who have spent their lives fighting for the rights of our people, who were only recognised as human beings in Australia in 1967. Today's session is an important one. Beyond the failed voice referendum here in Australia late last year, I encourage you all to think about the discussions today, beyond the rest of the meeting and everywhere you go, and think about how you can act to facilitate positive change for Indigenous peoples in your communities. Thank you.
Thank you very much, Olivia, and join with you in solidarity as an ally of Indigenous people. And also I'd like to pay my respects to Indigenous people, not only from Australia, but also from around the world. This particular session has been inspired by the recent release of the International AIDS Society Lancet Commission report on health and human rights. And also, as we've been listening through the entirety of this conference, the emphasis that's been placed on community, the sense of achievement and progress that has been made in communities. And effectively, if we want to look for where success lies, it exists at the community level. I'd like to extend my appreciation to WHS for hosting this forum and their support for the participation of members of the Victorian community. I'd like to acknowledge the contributions of the Victorian Council of Social Services and colleagues from Gippsland who have contributed to the organisation of this session but could not be here due to their ill health, and we respect their decision not to participate in the interests of our collective health. I'd like to introduce our speakers. Professor Adiba Kamarul Zaman is CEO, Pro-Vice Chancellor and President of Monash University, Malaysia, and was co-chair of the International AIDS Society Lancet Commission. Anushka Geronimus is the Director Youth Law Program at West Justice at the Western Community Legal Centre. She has a deep interest in the rights of young people in conflict with the law and is committed to effective advocacy on their behalf. Brent Allen is Senior Advisor with the Australasian Society for HIV, Viral Hepatitis and Sexual Health Medicine, ASHM, and representative of the National Association of People Living with HIV Australia. Brent is a passionate advocate for civil society and consumer representation and health service policy, programming and evaluation. And they have been a vocal advocate and champion for the rights of sex workers, people who use drugs, as well as vulnerable and marginalised people working on the front lines with gender and sexually diverse communities. Kirsty Machen is the Executive Officer of Positive Women Victoria. Kirsty brings a wealth of experience in HIV journalism, advocacy and policies, including infant feeding options for women living with HIV, quality of life, and barriers to the participation of women in HIV clinical and cure research. And my co-organiser, Lucy Stackpool-Moore, is founder and managing director of Watipa, a social enterprise working to enable equal societies, just development and equal health for all. Lucy is passionate about addressing health inequalities and enabling the realisation of human rights, particularly in relation to HIV, and reducing stigma and discrimination. And of course, she was also a member of the commission who put together this great report. So please join me in welcoming our panel, and I'd like to hand over to Lucy. Thank you.
Thank you very much, Jonathan. Thanks everybody for spending your lunchtime with us today. We appreciate it, and really thank you very much to each of the panellists for being here today. And I'd like to add my acknowledgement and really appreciate Olivia, you doing that for us, and all your support behind the scenes for this session, and Rhiannon and all the conference organisers. I'm not going to say too much because I want you to hear from everybody else, but just to start by saying this is really part one of a fantastic discussion on these issues. Part two is immediately following this on the main stage, so please join us for both and think of this as one extended conversation, because as I think the theme of today and many of the sessions are speaking to, it's so important to understand the local realities of these issues and connect those with the global conversations and vice versa. So please do join us at the main stage as well as contributing today. So the IAS Lancet Commission was just launched on the 21st of March 2024. It's free and online, and I'd encourage you to download the paper and maybe read it over a couple of days. It's a pretty lengthy document and is pretty dense, but we are now working on walking it in and making it accessible and understood, and connecting it with different realities and different contexts and different conversations around the world. The title of it is Under Threat, and what I really wanted to do before handing it over to the panel is to just explain a little bit about why now, why the Commission, why it's important and still resonant just as much today as it was 4 years ago when we started this journey. And so I just wanted to read a paragraph or two from the opening executive summary of the report, because it says it better than I would, the product of many minds. So, global commitment to human rights has deteriorated steadily in the 21st century with serious and increasingly damaging effects on health. By every available measure, the gains in human rights in the decades after the endorsement of the Universal Declaration have begun to reverse across much of the world. Authoritarianism is on the rise. The ability of civil society to operate without unreasonable official regulation is declining. Conflict and violence are surging, and violators of human rights act with increasing impunity. A global backlash has emerged with respect to gender equality and sexual and reproductive health, threatening to erase decades of progress. The centrality of human rights in the global health field is also increasingly in question, although the pandemic accord being drafted by the World Health Organization member states refers to the importance of human rights and equity. Substantive provisions of the draft agreement incorporate language that is advisory rather than obligatory for countries. The deteriorating human rights climate is having far-reaching effects on human health, as evidenced by the stark racial and ethnic disparities in COVID-19 hospitalisations and deaths in many countries, the preventable deaths each year of thousands of migrants at sea, the rise of heat-related mortality and in the number of climate refugees, the loss of sexual and reproductive autonomy and rights in countries where abortion access is restricted, and a growing toll of non-communicable diseases in low and middle-income countries because of predatory commercial marketing of tobacco, sugary beverages and highly processed food. Potential health benefits from the rapid rise of social media and the growing use of artificial intelligence risk being overwhelmed by these platforms' facilitation of the spread of health misinformation and disinformation. So it's a little bit bleak, but not to worry. There's some things that we can do, and this report and this commission, we argue that the health field should lead in making the case that respect for human rights is essential for human survival. Only inclusive societies grounded in acceptance, mutual respects and collective solidarity can muster the unified responses required to tackle the complex existential challenges faced by humanity. By centring human rights, the health field could serve as a model for human rights approaches in other sectors. However, the health sector does not have the means to single-handedly address the many human rights abuses and violations that affect health and wellbeing for all, but we can certainly lead in that space. So I'm very proud of having been involved in the Commission, and I'm extremely grateful and humbled to have been part of that process. And Adiba Kamarulzaman needs no further introduction other than she's an incredible inspiration to us all and a great mentor and friend to me. So thank you very much, Adiba. I'd like to hand over to you now. Thank you, Luciana.
Good afternoon, everyone, and thank you for joining us in this session. And as Lucy said, I hope you'll join us in the main session later. And thank you, Olivia, for that wonderful welcome to country that I could never say as profoundly as you just did. So, as president of the International AIDS Society, as the immediate past president, I wanted to do something to kind of bring together 40 years of the HIV response at the 40th year in 2020. So Chris Byra, another past president of the International AIDS Society, and I kind of discussed and what should we do. And we landed on health and human rights because the HIV response has really, within the health field, I guess, been at the forefront of recognizing the importance of rights and evidence, of course, in ensuring and implementing programs and looking at the ability to reach all the goals that we want to is not going to happen without paying attention to human rights. And this, of course, was recognized way back in the early history of the HIV response by Jonathan Mann and many others. And it has become almost second nature to HIV programming that we need to pay attention to health and human rights. And thus, this project was born, and we reached out to the Lancet, and they said, great idea. Of course, we didn't want it to just be about HIV/AIDS. We wanted it to be beyond HIV/AIDS and beyond sexual health and reproductive rights, and that it's important to hear the voices of others other than just health professionals. So we included, and how do I move here? Is it a touch screen? No, it's not a touch screen. This. So we brought together 23 other experts, either in health or human rights. There are others from also from history, from scholars of history and social science, and we wanted to make sure that it represents the globe. So we have, I think, people from every continent apart from the North and South Pole. And little did we know when we started and began our conversation on this via Zoom that a pandemic was going to intervene. And so part of the reason why it took us 4 years to do this was because there was that pandemic that intervened, and we were doing this by Zoom every month. We would meet once a month, every Thursday evening, because to make sure that we covered all the time zones, evening for me, and landed on 8 domains. Originally, we landed on 7 domains to really look into. Richard Horton, the chief editor of the Lancet, at the very last minute said, guys, we want you to also examine artificial intelligence. So we have the 8 domains, as you will see later on. So the framing questions that we had in these monthly discussions that we did was, what is the future of the health and human rights movement? And secondly, how can the health and human rights framework be revitalized and reinvigorated to achieve healthy communities? And what domains of the health and human rights framework are most relevant for ensuring robust health systems and universal access to care? We put these thoughts together through a socio-ecological model for health and human rights, and really placed human dignity at the center of the discussion and of the goal we want to reach in terms of health for humanity. And like I said, in the intervening period, Lucy's read a list of the challenges that we all currently face. Not only the pandemic, and with the pandemic, the issues around misinformation and disinformation and mistrust of science, but also in the more intermediate intervening period, of course, more and more conflicts around the world, including assault on healthcare and health facilities. So we kind of have a lot of work cut out for us, and these are the 8 domains that you will find in the publication. One on pandemics and equitable access to essential interventions, the climate crisis, and the intersection within health and rights in how we respond or not to the climate crisis. I mentioned conflicts and displacement, migration and refugees, structural racism, sexual and reproductive health, misinformation, disinformation, artificial intelligence. So we formed groups of experts to really look deeply into these 8 domains and at the end of each domain came up with some recommendations, which Lucy will... am I sharing it now or later? Yes, I will share it now. I will share it now. In the second session, Lucy is going to share it. Really what is clear is that through this intervening 4 years as we worked on it, we all came to the conclusion that we need to recenter human rights if we are to achieve health and well-being for all. And as Lucy mentioned, we in the health field needs to recenter human rights in health practice and work with partners and champions in other fields. I think often health professionals feel that we need to leave the issues and discussions around human rights to human rights experts. It's got really nothing to do with us, but in truth, it has everything to do with us in day-to-day, in our day-to-day practice as a clinician, as a health advocate. If we do not center those actions around human rights, then that's when we see that we're not going to achieve what we set out to achieve. We need to transform international order and global governance and accelerate the decolonization of global health. You'll hear more about that when we speak about, when you hear the presentation on structural racism in the next session. Ensure equitable representation of people from all global regions and involvement of communities and civil society in health sector reforms. And of course, we will not achieve this goal of health and well-being and human rights if we do not undertake legal, policy and programmatic changes across the 8 domains of the Commission. I mean, like I shared yesterday, in this region, we are far from achieving the 95 goals of HIV/AIDS, simply because I think one of the biggest barrier and challenge working with key populations is the existence of laws in at least 37 countries in Asia and the Pacific that criminalize sex work, criminalize drug use, criminalize men who have sex with men, etc. So until and unless we undertake this really difficult for policymakers discussions, we will not move the dial in terms of achieving health and well-being for all. So with that, as Lucy said, the purpose of this afternoon's session is to kind of see how the recommendations contained in this publication, in this article, what it really means to the people of Victoria, what it really means to communities working in this field. And we would like to have a conversation. What you know, are we being realistic? What else do we need to do? How best can we disseminate the findings? How else can we get others involved in really lifting the conversation on the importance of human rights for health? Thank you.
Thank you so much, Adiba. We're now going to hand it to the panel just to give an overview for some of the key questions that you'll be listening out for from the different perspectives of Brent, Kirsty and Anushka, is how the language of human rights does or does not resonate with their work, how a global effort such as the Commission and its report and recommendations is useful for strengthening or not localised efforts, and any suggestions for future global efforts such as a Commission on how they could be even more useful and utilised in a local context. So with that in mind, Brent, I'd like to invite you to, or Anushka, please.
Yeah.
No, beauty before beauty. Okay, please go ahead.
Okay, thank you. I'd like to introduce my topic. So I'm going to talk about the work into a mic. I'm going to talk about the work that I am part of at West Justice and also Smart Justice for Young People here in Victoria, and the work to end the youth criminalisation of young people aged 10 to 25 in the criminal justice system, and also the overrepresentation of particular groups. And the good news, I know there's been a lot of bleakness from what I can tell, but the good news is that the case for rights remains. And I think it's how we communicate that case and how we make it accessible and bring it to the people who will be the ultimate beneficiaries of that way of working. And so that's why we've adopted a collective impact and systems change approach as a way of making sense of human rights. So I'd like to acknowledge Olivia, and also the beautiful acknowledgement you did, and I'd like to pay my deepest respects to the traditional owners of the lands that we're all on, and pay my respects to elders and Aboriginal people here in the room, and also just declare very loudly that this land was never given, it was taken, and so this is and always was and always will be Aboriginal land. So I'm going to talk to you about West Justice. Who are we? What do we do? Why are we here? And also smart justice for young people, and also introduce two key pieces of work which potentially is really connected to this work of the Commission of Human Rights in the context of crime. And that is an action plan to end the overrepresentation, and also Target Zero, ... we'll tell you more in a second, and also then connecting this work to those questions, Lucy, that you've just posed. So West Justice, what are we? Hang on, there we go. We're a community legal centre based in the west of Melbourne. We're funded for 3, but we cover somehow or another all 5 LGAs. Our clients and broader community experience high rates of all the issues that have been discussed across yesterday and today. Socioeconomic and health inequities, poverty, high rates of alleged offending and remand. The youth law program, which I oversee, is one of the 4 legal areas, and we also have economic justice, family violence and family law, employment and equality law. And it's really important for us, me as the director of the youth law program, to make sure that I am actively trying to connect the work that I do in my section to the work of my colleagues in the other areas to break down the silos, which is one of the biggest contributors to the problems, I think, in both the criminal justice system but also health. And not that I'm a health expert. And that's what we do in the youth law program, provide legal advice, but then also legal information, and then also using what we see and hear from our clients, what we observe, and from our partners to try and activate for system-level change. And then Smart Justice for Young People is a coalition of approximately 50 cross-discipline, cross-sector members supporting youth in contact with the justice system across the state of Victoria. So that just gives you a sense of how we've gone about trying to organise our work. I think it's really important when you're embarking on this type of work just to get a sense if you're going to say, are we implementing human rights or not? I think you need to figure out, A, what do you do? How does it connect to human rights? And then how are you organising your work, and how does your work connect with the work of others? So that may mean nothing to you because it's got some abbreviations, but just to give you a sense, we work in place. So we have lawyers in schools in the west of Melbourne. We do outreach to residential care homes in the west of Melbourne, and we also have Target Zero, which oversees, and that is overarching all of the work that we do. And also you can see Smart Justice for Young People there to the side as clearly connected to the work that we're doing, so that I'm not inadvertently working in silos myself. So the starting point is maybe it's not just them, and might well be us as well. When we're talking about systems change, when we're talking about what needs to happen, often the conversation is directed at government. But I think my reflection on the work that I've been doing and what I've been part of is that sometimes it's us, and I think it's very important to reflect on that if we're talking about change and how we can be part of change. and so that we don't feel powerless. Listening to all of those discussions that happened today and all of these recommendations, the question for us is what can we do right now with the resources that we have and the discretion that we have and the funding that we have as a start, because legislative change, policy change may take time, but then let's not stand still. Let's figure out what we can do together with other people who share the same worry that we do for the problems that we're concerned with. So in terms of the problem, one of the things that we discovered in the criminal justice system, you will hear, it would seem that it is the only topic of discussion across the whole of the Eastern Seaboard and in the Northern Territory right now, but yet really you've only got about 200 children in custody right now. But you look at the media and it's like the most important issue. And so that's something to bear in mind in terms of placing this issue in context with others. And you compare it to family violence and the risk to women on a daily, weekly basis in terms of what is the issue of most concern. So one of the things that is fact and not contested is that there are 5 groups of young people who are chronically overrepresented in the justice system, and so that is, it's not a matter of how, but when they come into contact, and they are those groups there. I'm looking at time, so I'm not going to list them. So fact 2. The Youth Parole Board report gives us a glimpse of what young people experience on entry into custody, and they give us clues as to where the the problems may lay, but also the solutions. Fact 3, despite the biggest spend ever in youth crime prevention, the overrepresentation of those groups is worsening, not getting better, which has to lead to the conclusion that what we're doing right now is not working despite incredible effort and commitment and intent. So the statistics, therefore, our practice and the lived experience of the communities with whom we work is telling us that what we've been doing may not be working and making the impact that we want to. So what can we do to shift things? Now, this is from the Youth Parole Board report for anybody who's interested in the criminal justice system, and what is clear from those stats there, that's an annual survey that is published in that, and it's just a glimpse, and it's not, you can see all of those data points. You're looking at family violence, you're looking at trauma and neglect, you're looking at misuse of drugs and alcohol, you're looking at self-harm, you're looking at all of these, their health problems, their social problems, they haven't collected it in the last couple of years, and maybe that's because of COVID, but 68% of young people were recorded as being suspended or expelled from school in 2019-20. So if we're looking at where the solutions may lay, it's in those areas, which connects so clearly to the health, and a kind of health equity, really. But for now, what we're doing is the system is criminalising rather than supporting, and incarcerating rather than enabling, and punishing rather than nurturing. And COVID, what was so clear during COVID is that everybody was at home, we were all in lockdown, and so there was a decrease in the number of young people in the criminal justice system. And to make the point that the number of young people in custody overall has continued to steadily fall over the last definitely 10 years. But the kids who are in the system, that overrepresentation figure has not budged. And so what happened in COVID is that everybody else was filtered out and they're the only kids in there. And one of the things that was really hard to avoid is that because during lockdown we had to isolate, you have kind of families with large numbers of large members, large family groups. They couldn't isolate, and the finding was that they were living in poverty. And so I think if we're looking at ending crime, we've got to look at poverty, right? Because crime is a symptom of poverty. So we came up with this action plan to end overrepresentation. It's the culmination of 2 years of work, and it aims to end the chronic overrepresentation of the 5 groups I mentioned before, and you've got 49 system-level asks, and it's incorporated rights-based principles, including self-determination, ending discrimination, etc., and makes clear that the responsibility is collective across government, statutory agencies and government-funded organisations. And it's got a focus on root causes, not symptoms. And you'll see there that kind of triangle may be hard to see, but it's a triangle that was worked from a group called FSG, and so we adopted that methodology. And what that triangle aims to kind of demonstrate are the 6 conditions which hold a social problem in place. And the policies, practices, resource flows, relationships, mindsets and power dynamics. And power dynamics and mental models, like your mindsets, are the hardest things to shift based on the projects that are currently underway. And the asks that we crafted are across those 6 domains, including there's a whole of government set as well as across those individual domains, covering health and wellbeing. And they span prevention, early intervention, justice response and reintegration. And Target Zero is, so that action plan is across the state of, it's directed at the state of Victoria, but this Target Zero is a collective impact project, place-based, that aims to end the overrepresentation in 10 years' time. And we have taken a place-based approach and we want to do it in Melton, Brimbank and Wyndham. We've got West Justice and CMY, the Centre for Multicultural Youth, are the backbone of that this project. We celebrated our 2nd year last year. It's broken up into 5 stages, and it's based on the same thinking about the status quo being untenable and the need for systems change. And yep.
If off, you can just wrap up.
I'll wrap up. Yep. Second, yeah. And we've got 21 members who support us. That's 19. So Foundation House recently joined on, and another wonderful local org. And the takeaway is that no one person or organisation or uni or academic can do it alone. It's too overwhelming and too burdensome at the short of it. But together, we can really make a difference. Thanks.
My name is Brent Allen. I want to pay my respects to the Wurundjeri people of the Kulin Nation before I begin. But I also, I'm here representing the National Association of People with HIV, but I really want to address you this afternoon as a member from the Living Experience Advisory Panel of the Victorian Government's Collaborative Centre on Mental Health and Wellbeing, and to speak a little bit about how health and human rights affects people with mental health conditions. And I want to talk about 3 things: isolation, marginalization, and representation. In the first, around isolation, there's been some great dialogue of late in the press around the effects, the health effects of social isolation, and how pronounced those effects can be on people's health. But I also talk about cognitive isolation and the elusive truth that seems to be harder and harder to grasp amongst the disinformation and the misinformation propelled by the media. And in particular, I want to point to something really specific about what happened at the Bondi shopping centre, and the fact that the individual was named as someone living with schizophrenia. And the fact that, although that may have been deemed by media to be an important thing, how that makes people with schizophrenia feel. What it does to us is puts us further in the closet and into the shadows where we won't talk about our conditions. And then those of you are afraid of us because you think we're going to do harmful things. Schizophrenia is neither a crime nor a cause. The other thing I want to talk about briefly is marginalization. You know, putting people to the edges are the ones who are most profoundly affected by human rights violations. Trans and gender diverse communities, I'm a proud non-binary individual. On my way here today, filling up with petrol. 2 guys in the petrol station wanted to know what I stood for. It was certainly not done in a supportive way, and it was certainly done as a way to make me feel marginalized. People living with HIV, we've experienced huge successes and huge amounts of stigma. People with mental health, and again, something recent in the media, because I was asked to talk about what's going on locally, the fact that the state government has now denied that they're going to set up an injecting room in downtown Melbourne, even though the overwhelming recommendations are to do so. Around representation, this is what, because I'm more solution-oriented, I really find the excitement in work about finding solutions to the intractable problems. And representation is crucial. Proximity is crucial. You know, I remember early on in HIV, we established these things called speakers bureaus, where someone with HIV would go out into community, to schools, to whatever, and speak about being someone living with HIV. We don't do that with many other marginalized conditions. We don't do that with sex workers. We don't do that with people who use or inject drugs. We don't do that with many people with mental health conditions, because we continue to marginalize them. We continue to other them and make them feel as if they should not and are deserved to only live in the margins. Finally, again, as something, you know, in a previous session, there was a great discussion about othering and the climate of fear that occurs when you other people. And I want to say more investment in knowledge translation and knowledge exchange, particularly innovative forms of knowledge translation. I was really proud to work on a project about HIV science as art, where we took complex science, translated it through artists' visions into something accessible that could be understood. These are the things that we have to do if we want to engage affected communities, as Professor Marmot said this morning. You know, we have to engage them in the first stage. We have to enable them, which means giving them skills and confidence. Some say embolden or empower, but it's enable. And finally, we have to ennoble people. We have to make them feel like their lives are worth living, and they can be proud about that. And those are the only ways, I think, that we're going to achieve dignity, agency, and respect that we've been calling for in this paper. Thanks.
I'm Kirsty Machin, the Executive Officer of Positive Women Victoria. I acknowledge the traditional owners of the land and past, present, emerging elders and Aboriginal and Torres Strait Islander people in the room today. I'm just going to talk briefly about a couple of things. We are an organisation funded by the Victorian Government principally that provides peer support and advocacy for women living with HIV in Victoria, which is approximately 12% of all people living with HIV. We have some 412 members, and most people who access our service, especially recently, are women who are born overseas because we are in a global pandemic. So I want to give a bit of context, and I want to talk about a couple of things that were alluded to as exploring in this session. So strengths, as I see things in relation to the aspirations of the IAS document, weaknesses, and maybe a couple of comments about where I think the human rights agenda sort of interacts with some important kind of issues for not just people living with HIV, but anybody accessing the health system. So in Victoria, there's been some relatively positive reforms recently, including sex work decriminalisation from an occupational health and safety model and towards one from a highly legal and punitive one. Safe injecting rooms, as Brent alluded to, has been a kind of mainstay of Victorian policy for a while, but it's not. These things are not guaranteed. It just goes to show that such things are always subject to the vicarious nature of political activity. Medicare access to HIV treatments, including non-Medicare card holders, came online, but again imperfect. And of course, we do have high rates of HIV treatment uptake, access to PrEP through the Medicare system, PEP, and so forth. But there are some weaknesses, and they're systemic. And when I talk about governments here, I'm talking about all governments of a sort of neoliberal stripe in our Western democracy. So I'm not singling anybody out, but I think we need to be realistic about the climate that we are actually working in. So the overall context of cost cutting is government debt, outsourcing of policies, policy expertise, loss of policy expertise post the pandemic. I want to talk about housing because it cuts across a few things in HIV. So we've got skyrocketing rentals, impossible purchase prices, housing as a small business model, and in Victoria, expected reduction in services and public housing at a time when we're going to need more. Some of our clients sleep rough, and in fact, housing is just a massive issue for all our clients, as it is for other people who are trying to achieve kind of, whatever the health outcomes they can get within the conditions that may affect them. So I think an individual human rights agenda is actually often in conflict with the operating assumptions and the agendas of the systems that we have to work in, and we don't say it, but it is. So embedding human rights into a system is costly, it's complex, it requires bringing communities with people through education, discussion and care. But governments are obsessed with spiralling debt, with cost cutting, with outsourcing of expertise and handing money to not-for-profit systems. And they see innovations in technology usually inappropriately and unrealistically as salvation. And governments are also often at least conflicted, if not disingenuous, about community cohesion, and election cycles based on marketing and personal saleability are part of a problem where fear politics conflicts with what people might want to achieve as individuals. So, and frankly, for-profit corporations simply do not have individual health rights as their priority. So, at the Act Now Forum on Global Migration and HIV at IAS, which I had the pleasure to be a part of, there was an examination of some huge problems relating to HIV globally. And I want to briefly mention that because our immigration system is a disaster and it doesn't have human rights as its main aim. So migration policies in our country, for example, using HIV as an example, often don't reflect the HIV science, they don't reflect treatment as prevention, they continue to characterise HIV as a public health risk. And this is all amongst the co-founders of global and socio-political sort of migration, so war, natural disaster, racism, COVID, you all know it. In Australia, there's been little change around those laws since the 1990s, and it still requires a HIV health waiver to stay here. There are many arrays of visas, differential impacts of a HIV diagnosis on eligibility in the application process, and the threshold grounds for rejecting applicants are really significant. So, one outcome of this is that people can be stuck in the migration process for a long time with no legal support, and we have examples of unsafe outcomes for our women, including remaining in unsafe relationships and women living in amount to what is enforced domestic slavery because they cannot work while they're awaiting their adjudication. This all intersects with housing, but it also intersects with another area where I just want to briefly touch on, which is ageing, and I think we haven't talked about it much here, but I think it is important. So in HIV, there's going to be an older population of people with HIV more unwell, poorer than the general Australian cohort, especially women born overseas, people living with HIV long-term, and women. And they may not have housing, superannuation, family support, all of which we consider or assume to be essential to a healthy ageing process. This is in a system where aged care is not necessarily seen as a right, but it's mediated by assessment processes where how effectively you can respond to the system determines your assessment outcomes and your eligibility to aged care. And the other day, the federal aged care reforms, which were talked about in the paper, it was noted that they're likely to make greater use of automated and AI assessments, leaving me wondering in any case, what has been learned from robo-debt. So, the potential conflict between individual rights and government agendas is high. And just when I finish, I just want to focus very quickly on one thing. So, Australia and Victoria are very focused on the virtual elimination of HIV. That is laudable and it is possible, but it comes with some risks the way that it's approached. The first is that it is achieved inequitably among some communities but not among others, and amongst those who continue to be overrepresented among those not accessing treatment, care and support. The second thing is it might be tempting to push this public health aim at the expense of individual rights, for example, by potentially less than informed or even coercive testing practices. And because the link between treatment and prevention, whereby treatment also prevents HIV transmission, this could lead people to being treated for prevention purposes, but without a truly informed opportunity to understand how treatment contributes to their own well-being, their personal thriving, their ability to negotiate and enjoy sexual expression and quality of life. And I think this all loops us back to the first question, in that we cannot achieve a quality of life for people with chronic illness, and we cannot have a human rights approach to healthcare within the context of a discriminatory migration policy, a total lack of affordable housing, a stigmatising aged care system where it is algorithms and not people and their needs which are the fundamental arbiters of access. So thank you.
Wow, I've got the unenviable task of trying to pull out some key messages from this, and I really wish we had another hour, but please come to the next one so we can keep talking about this. But really, please, let's give another round of applause to the panel. That was excellent. I'm not trying to oversimplify, but there's 5 things that I heard from that I'd like everyone to take with you to the main stage. The first one is really linked to the social determinants of health and how these things around poverty, ill health, inequity, gender, exclusion all interrelate and overlap. Unfortunately, Anushka, you said that crime is a symptom of poverty, and I think it's often a symptom of ill health as well, and I think that's a great way to think about it. The second one is a bit linked to what Brent was saying, and it made me think about really the importance of mental health and how it can be an effect of human rights violation as well as a cause, and an unfortunate trigger for exclusion and isolation, as you described. A third area is that no one person can do it alone, and that it can be really burdensome, and to really recognise the courage and conviction and determination it takes for people to stand up for these things in the face of systems, but also recognising that systems are entrenched and overturned by people. So there's an agency in that I know many people in here are working towards improving, but also recognising that these things can change and be improved. Fourth one is, goodness me, this word ennoble, I loved it. It's wonderful, and the centering of dignity, the diversity of who is at the centre of all of these, who's entitled to the highest attainable right to health, is absolutely around dignity, around respect, around entitlement, and looking on how to reflect that diversity and respond to the dynamic nature of identities, and also the dynamic nature of experiences, which can be enabling and ennobling and also profoundly negative, all in the same car trip, probably. And the last one, Kirsty, yours is a little bit depressing, so I'm trying to find an optimistic spin on it around this, and thinking through and it links to something Brent said, it isn't a zero-sum game, but we need to be able to articulate that in a way that meets people where they are. So talking about rights in a way that makes good business sense to people is one way to try and remove that tension between individual entitlements and what is in the public good and makes good sense for governance as well. And I think that really links to what Brent was saying about knowledge translation and exchange, and being really clever at how we can communicate and engage around principles of achieving equity that's in everybody's interests, hopefully, and not alienating anyone. So I don't know, Jonathan, would you like to add something there?
Thanks very much, Lucy. Well, thank you very much to our panel. Really appreciate it. We're going to have to draw this to a close, I'm afraid, but I don't have to go directly to the plenary session, so I'll stay around if any of you would like to have a conversation. This report is fresh. It's just come out the end of March. We have an obligation and a strong desire to socialise that report. It's got some very key messages, and as you've heard today, it's really important how we bring that to life. There's a lot of life in it already, given the examples that we've heard, but we do need to be able to take it further, because there's nothing more fundamental to health than human rights. And so we'll continue this conversation at least today in the session, which is in the main plenary. So please join us there. And otherwise, thank you very much for joining us here today. And please join me in thanking the panel.